Hello to those joining us to watch this very special Skill Futures event. I would like to start today's session by introducing myself. My name is Rebecca Lawler, and I am the Program Manager of the Skill Futures program with Skills Canada Newfoundland and Labrador. SCNL is a nonprofit organization that promotes the importance of skilled careers to youth across our province. We do this through various programming throughout the school year, one of them being our Skill Futures events. Skill Futures events are designed to educate youth on various topics, including the numerous skilled careers that exist. One major part of Skill Futures events is mentoring opportunities, where students can meet with and have their questions answered by industry experts. I would like to note that before we continue, Skill Futures events would not be possible without the support of our provincial government. Today, we are extremely excited to welcome our special guest, Dr. Janice Fitzgerald, Chief Medical Officer of Newfoundland and Labrador, and SCNL's Executive Director, Carole Ann Ryan, to facilitate a Q&A session. Today, Dr. Fitzgerald will be answering questions that have come directly from youth in our province. So with that being said, we are so excited. So without further ado, I would like to introduce Carole Ann Ryan, Executive Director of SCNL, who will be facilitating today's event.
Thank you so much, Rebecca. And Dr. Fitzgerald, welcome. We cannot tell you how much we appreciate you taking out time from your schedule. We know demands on your time is high, so we're truly thankful for you joining us today.
Well, thank you for inviting me. I'm happy to be here.
We're really excited about this topic today and to have the opportunity to chat with you because it's such an important topic all year round and every year, but especially this year, and that's safety and how youth can be leaders in this extraordinary time. So over the last 6 months, Dr. Fitzgerald has become a household name, a bit of a rock star, if we're being honest, not only in the province, but of course all across the country. And, I want to let you know, even personally, the first couple of months when it felt like our world had just turned upside down, there was chaos, there was uncertainty. For me personally, and a lot of people that I've talked to, having that touch point every day, knowing that we were going to hear from Dr. Fitzgerald at 2 o'clock every day, who was going to give us an update, give us a little bit of constant in this time of flux and change. And we were so reassured by your calm demeanor, your confidence, and your leadership. Many of us really came to rely on that constant. It was like a lifeline for those of us who were trying to understand what was happening. And it must have been daunting for you, no doubt. You were sort of thrust into the spotlight, but you certainly exemplify leadership under pressure. So I guess my first question for you is, were you surprised by sort of the reaction to the community about how important and what a touch point those COVID updates became for the community every day?
Oh, thanks for the kind words. That's very nice to hear. But I think I was surprised. Our purpose, and we know as medical officers of health that a part of our role is to communicate with people about anything that's happening from a health point of view. So I think we know that that's an important part of our job, but to see the effect that it had on people to do that, it was a little overwhelming, I will say. I kind of like the obscurity that I had,
Yeah.
but it is. People have been overwhelmingly kind and thankful, and I think I am very grateful for that. But yeah, it was a little overwhelming as to the importance of it. But I think if we look at the times we were living in, with the uncertainty and increasing cases, and people were scared, I think I'm really happy that we could provide that level of comfort, I guess, for people, and so I do think it was a good decision to make to have those regular updates.
Absolutely. I really and truly feel like it was a lifeline to a lot of people. It was like the one thing we could count on in this time of chaos. And so now, of course, we find ourselves 6 months down the road. Students are back in school. Many have started participating again in extracurricular activities, and in some cases might be expanding their social networks a little bit more. So really, what extra precautions would you really recommend that our students take to keep their social networks safe?
So we've always said, remember our little mantra, people, space, time, place. So you need to make sure you keep the number of close contacts you have in a run of a day, in a run of a week, as small as you can. You need to make sure that you have enough space between you and people who are outside of your bubbles to ensure physical distancing. And you need to make sure that your interactions with people are, with people outside of your bubble are not prolonged, and if they are prolonged, that you take measures to make sure that you're keeping those interactions as safe as possible, and then as much as possible be outside as close to inside. So it is important to remember all of those things. We know that this virus can spread easily through close contact with people. We know it spreads easier in indoor situations. And we know that the longer you're around someone, the more of a chance there is to spread it if it is in the room. And so, that's everything we're learning about. The information that we're learning about this virus is changing on a daily basis, it seems like sometimes. But, those are the constants that we know to be true at this point, is that it spreads when people get together and when they're in each other's presence for a prolonged period of time. And so keeping those contacts small decreases the spread. So that's the reason why we ask people to do these things. And I know it's been difficult. It's been extremely difficult. And by nature, we're creatures who love to be around people in general. And so I think, that's been hard for people to understand. And especially now we've done such a good job at getting our numbers low. People may feel like, we don't have to worry. But this virus can still get into our province. We've seen that, we've had importation of cases. Thankfully, people have been following the recommendations and the rules, and so we haven't seen a large amount of spread from those cases up to this point. And but it's still important for each and every one of us to try to remember these new rules, so to speak, with living with COVID.
And I think that, I'm not a teenager anymore. I can imagine how difficult it is, particularly at that stage in their lives. So I think that we have to give a lot of credit to the youth who are being leaders and who are following the regulations and rules. And one thing that I'm sure frustrates you to no end is the keyboard warriors who suddenly have scientific and medical backgrounds. And I know that must be frustrating to deal with, but I have to say your steadfast direction and calm, again, your calm demeanor is really a benefit for all of us. So there's people who say, of course, and we've heard people saying, oh, it doesn't affect young kids. They're less likely to get COVID-19. And if they do, they're probably not going to get that sick. So some people are probably not taking the precautions that they should. So what message would you like to give young people about how important it is for them to follow public health regulations, not just to protect themselves, but those around them?
Yes, and thanks. That is an important point. It is, by and large, and this is true for a lot of diseases, we know that the older you are, or very young sometimes, or the more underlying medical problems you have, those diseases will affect you more severely than they will young people. That's true for influenza, for example. So we see that in lots of diseases. But what we have to remember about this disease is that really, comparatively speaking, there are very few of us who have immunity to it. So we're all susceptible to it. We have, there's 270 a little less than 270 people who are actually that we know have been exposed to this and likely have some immunity to it. But, on the whole, in general, people in Newfoundland don't have immunity to this virus. So we're all quite susceptible. We can all catch it quite easily. We know it's fairly easily spread. We do know that, yes, it is likely that a majority of young people who get this disease will have mild cases of the disease. However, that is not true for all of them. We have had deaths in people under the age of 19. And, we have certainly seen with every age group, we see increasing deaths and infections. So, and the other thing we have to remember about all of this is that when this first started, most countries shut down schools. So we really don't have a lot of information about infection in school age people, because a lot of those kids weren't in the situation where they would normally be to pick up this infection. And so, that's why we're taking all these precautions as we go back to school now, because we want to make sure that, we can reduce that spread. But we do know that it can spread between children. And we know that it can, it's more likely to cause more severe disease in those over 10 or 11 years old. So young people, adolescents, and the older you get, the more likely you are to develop more severe disease. And that's true all the way through the spectrum of life. But and part of that has to do with the way the virus actually affects the body. It has to do with the receptors that the virus triggers or targets, in the body. And we develop more of those as we get older. So, but then there's also the other thing, as you said, the other thing to consider is that you have other people around you who can actually get sick, who you can pass that virus on to. Even if you don't have symptoms, you can still pass that virus on to people around you. And so that's the thing you have to consider. Most of us have people around us who would be more susceptible to severe disease. So they could be immune-compromised people. They could be people who have underlying heart or lung disease. They could be older people in general. These are all people who can have a more severe disease and are much more likely to be admitted to hospital or to ICU or to die from the disease. So, you have to think about that as well. So all of what we're asking you to do, I realize, is very difficult, and it's been going on for a long time, and it seems like forever. And we're going to have to ask you to continue to do it for quite a while yet before we have a vaccine that we can give to everybody. But it is vitally important that it continue, because right now it is what we know works to help prevent the spread of this disease.
And that's kind of a good segue. I'm going to sneak in a little question here that I realize you don't have a crystal ball and realize that you can't predict the future. But, those of us who have kids in dance schools or for Skills Canada and our provincial competitions, for proms, for sports, do you think there's any chance of any of those things happening, say, in May and June of 2021? Or should we all really be trying to think of how we can shift to more virtual experiences?
Yeah, it is difficult to say. And we don't have a crystal ball. We don't know what's going to happen. I honestly didn't think we would be where we are right now in Newfoundland and Labrador when we were looking at things back in April. I thought we would be seeing more cases. I thought, and I'm very happy that we're where we are. And I think the reason we are is because of the way that the public and everybody stepped up to do their part. So that's really important. But when we're talking about large gatherings, we know that those are the things with the highest risk with regard to transmission. It will very much depend on what our prevalence level is, what the prevalence level is elsewhere in the country, and what our risk of importation of the disease is. So what's the risk of actually getting cases imported from elsewhere. So we have to take all of that into consideration before we can make decisions about these sorts of things. And I think at this point, we're just too far out from it to really make a decision. we're certainly slowly increasing our gathering sizes. We're slowly increasing situations where there may be more people, like for theaters and these bigger venues. So we're starting to see, and everywhere across the country is just doing that now, So we're going to have to see what happens when we do that, and see how COVID, what the epidemic. That's the unfortunate thing about all of this, is that we're learning as we go. This is a new virus. We don't have hundreds of years of information to draw on to make these decisions. We're trying to make decisions based on what we're learning as we go, and sometimes we're learning something that's completely different than what we've learned from other diseases. So it is it's very difficult to make a decision that's 6 or 8 months out from now, because in 6 to 8 months' time things could be very different.
So I'll turn to parents for a quick second now. It's really important, as you noted, that we all follow public health measures and guidelines. So for those parents who, their child wakes up in the morning and they think they have a cold, it's a little bit of a sniffle, I know you've given very clear, fantastic guidelines of the symptoms and what process to follow for us who are parents. But is there any advice you can give? If I'm a parent and my child wakes up and they have a little bit of a sniffle and they're sneezing a little bit, we think it's a cold. What is the best process for making the decision about sending them to school or keeping them home?
Yeah, so this is really important. And we know that one of the most important ways that we can keep our schools safe is if people stay home when they're sick. And that's staff and students. And so right now we're recommending, if you have 2 symptoms, that you stay home, 2 of the symptoms on our list, that you stay home. And there's new information coming in right now as we speak with regard to that, because we've had some jurisdictions across the country have been in school a little bit longer than we have, and they've had some infections that have happened in schools and in children, and they're actually analyzing their data now. So, we may find in the next week or so that we'll have to come out with newer symptoms or a more refined way to look at that. And that's all part of the learning curve that goes with this disease, with any new disease, really, right? Right now, though, we would recommend that if you have 2 of those symptoms, that you stay home. Certainly, if you're home if you have a fever and you're feeling miserable, even if you don't have any other symptoms, you may should consider staying home, because fever is certainly one of those symptoms that's a bit of an alarm, right? So at this point, until we know more, until we learn more about all of this, we would certainly recommend that if you're not feeling well, that you stay home at least until 24 hours after your symptoms have resolved. If you have a COVID test done and that test comes back negative, then 24 hours after your symptoms resolve, go back to school, no problem. If you have a COVID test done and it's positive, well, then obviously public health will become involved then, and we'll go through a whole process that we have to go through in that situation.
Okay. And speaking of teachers and a lot of the change that's happening, teachers have a very special place in the Skills Canada family. We have some phenomenal volunteers and teacher liaisons who welcome us in the school in a normal scenario and really encourage youth to partner with Skills Canada, participate in our events. So it's really important to me personally, and of course to Skills Canada, that we do everything that we can to support teachers during this time, because they are faced with something that we all sort of moved a little bit back into the workplace at Skills Canada. We moved back for 2 days a week just to see how that goes, to see how we can keep each other safe. So teachers find themselves not only trying to keep themselves safe, but a whole class or a number of classes. And I know that, as you mentioned, that the recommendations are changing as we learn new things. And these teachers are constantly getting new information and new ways to manage things. And I worry about them. And at our home, it's important to me that I instill in my children how important it is to respect the teachers, respect the direction that they're given. So what message would you give to parents about, what role they can take at home in helping the kids understand how important it is to follow the directions their teachers give them?
Well, yeah, I mean, that is important. The teachers right now are, they're in a situation where they're trying to do the best job that they can to make sure that our kids stay safe. And if parents and teachers and staff in the school and the students themselves are not all singing from the same songbook, so to speak, we're not all doing this together, then it's going to be very difficult for that to work. So I think it's important for parents to realize that, initially this is going to take a little bit of patience. Everybody, we're learning as we go. We're trying to work through some things. You're trying to come up with the best solutions that you can. And once you start to work through it, you may realize, that's not the best way for this to work. We've got to have a little bit of flexibility and understanding that, this is going to be a process and we're going to have to work through this. So patience is really important. But I also think it's really important for parents to, especially for younger children, to say, it's okay if you have questions. You're allowed to have questions, and we'll try to answer them as honestly as possible. But I also think it's important to not let our own fears as parents spill over onto our children. We want to try to keep this as safe as we can. And while we all have fears and we all have concerns about safety and all of that, I think it's important for children to know that when they're going to school, that there are people there who are there to protect them and to keep them safe. And we can have those concerns as parents. It's absolutely fine to have those concerns as parents. It's absolutely fine to ask the questions and to make sure you have answers that you're happy with and that you're satisfied with. That's 100% important. But we need to work through that as adults in the situation. And we need not to sort of have that fall onto our children, who really have very little, especially younger children, have little control over the situation, right? Now, as we have children who get older, I think it's really important for parents to engage those children in discussions and to understand why they have to do the things that they have to do. We may not agree with every rule that's been put in place. We don't have to agree with every rule that's been put in place. I mean, that's part of our lives. There are lots of rules that we may not agree with, but we still follow, right? Because they are, I think underneath it all, we fundamentally understand that most of these are put in place to try to help keep us safe and to help society function as well as possible. And so I think we have to remember that as parents, and we have to engage our children into that discussion and say, this is going to work if we're all working together and following the rules. And it's not going to help anybody, if you're not following the rules. Deciding that, you may not like the rule, but so it is, and I think it depends on, our children as they get older can be brought into those discussions, absolutely. And I think there has to be an onus too of responsibility on children once they get to a certain age that, the expectation is that you are going to follow these rules, and that these are important. They're here to keep us safe. And I mean, my experience to date and what I've heard so far in a week into it is that most people are actually doing what they need to do and understand. So I've been very pleased with what I've heard up to this point, and I know that kids have it in them. Especially adolescents. I've been amazed by what they can do when they want to put their minds to things many, many times over and over again. So I know that they have it. They know what they have to do to keep themselves safe.
Wonderful. I mean, we see it every day, of course, at Skills Canada. the youth that we work with, that we deal with. I mean, the leadership skills and that we see in the youth of this province is remarkable. And I would really reiterate your point about understanding and patience.
Yeah.
Because of course it's been so frustrating as we try to navigate this, but it's so important for us as parents to demonstrate that to our kids, that we have professionals who are giving us the best advice and to keep each other safe. It's not just about me, it's about our community, and we have a role in that. So I'm so glad to hear that you're hearing that people are following those rules as well. So to pivot a little bit, something that's close to my heart, and to Skills Canada as an organization that encourages young women to pursue careers in underrepresented fields. Of course, women have traditionally been underrepresented in health leadership positions. And yet, remarkably and wonderfully, I believe it's 14 out of the provincial and national chief medical officers, 7 are women, including, of course, Canada's chief medical officer, Dr. Cam. And what a phenomenal thing for girls across this country to see, right? And I will say that, you personally have been such a strong leader, bringing us through this crisis. And I really believe this is going to have a huge impact on young women who might be, potentially either considering a career in medicine, in public health, or even in leadership roles. And I really and truly believe that this is going to influence a whole generation of girls in this province. Not to put a huge mantle on your shoulders, responsibility.
You're going to make me cry now.
Well, you already know I'm holding back tears. Anybody who's watching this who knows this is hard for me to get through because it's so important to me.
Yeah.
But, my question to you is, you can certainly elaborate on that and your colleagues from across the country. But did you have a role model? Did you have a mentor when you decided to be a doctor? We already know that it's so important for girls and other communities to see someone who looks like them in these roles, to really have faith that they can do it. Did you have that role model? And what conversations do you have with your fellow chief medical officers across the country about what an important time this is for women?
I don't know that we've had much in the way of conversations. Just because we've all been so busy, and there hasn't been a lot of time for conversations other than COVID. But certainly I think we all appreciate, or we all recognize the importance of seeing women, strong women, taking these leadership roles and doing a good job at handling this crisis and in the provinces that they're in and in the countries as well. It's not just Canada that's been showing them. So I think that's really important, and I have been very proud to be a part of that. I think for me, there have been a lot of strong women in my life, and I've been very, very lucky in that regard. So, my mom, who worked in a laboratory, medical laboratory, and she worked my whole life as long as I can remember. She was working mom who worked in sciences at a time when not a lot of women were going into that field of work. So that was really important. Both my parents have put a huge focus and attention and emphasis on education and science education. So there was that expectation of not necessarily going into the sciences, I don't think, but certainly the expectation that you could be whatever you wanted to be, and you could do whatever you wanted to do. It was never. I can honestly say, growing up, it never ever came to me that I would not be able to do something because I was woman. It was not ever presented as an obstacle in my home, which was wonderful. Now, once I got out into the real world, sometimes that I certainly had that hit me in the face that, you were treated differently because you were a woman. But by and large, I think, that has been very lucky for me. And I have an aunt who is a physician as well. And I certainly look up to her a lot. And I would say that she certainly was a role model for me. But I've been very lucky to have my life filled with a lot of really strong women, and I draw on them for support. I think it's really important for us as women to support each other, to help lift each other up instead of looking for reasons to tear each other down. And I really find that, well, I always say that young feminists are my kryptonite. And out there, and they're being so, they're really working hard for something that they believe in, and they're standing up for what they believe in, and they're not accepting the status quo. I think that's really important. So, I think you need to surround yourself with people who make you a better person. Right? That's the most important thing, and then you have to be that person for someone else too. You have to try to make somebody else a better person, or be that source that somebody can say, you make me a better person. Give that support to somebody. And I think as we tend to do that as women anyway, we tend to be a supportive network. We tend to draw together. It's just been that sort of natural way that we like to communicate, we like to get together, we like to talk and share stories and share experiences. That's very lucky for us that we're able to do that. I wish that that was the case for everybody, So yeah, it's I think I have been we are all the product of where we are right now is because of a whole pile of factors, and one of them is your support system, and I've been very, very lucky.
So now we're going to move on to some alumni questions. Youth and the voice of youth is so important to Skills Canada. We make sure that we have youth representatives at our board table when we're making policy decisions, when we're developing programs and events. So when we discovered, of course, that we were going to have this interview with you, which we were so thankful for, a very important thing for us was to survey our alumni and to find out what was important to them, what questions that they had for you. So in this next segment, we're going to present 5 questions that have come directly from our alumni.
My name is Ali Ragg. I'm a current student at Memorial University of Newfoundland and a past medalist at SCNC's photography competition. My question for you today surrounds returning to school and work in person. Some students may be experiencing heightened anxieties about returning to classes this school year. What advice would you give to anyone who's had significant stress about returning to work or classes in person?
Question, and we know that there's a lot of anxiety. How could there not be? Our lives have been turned upside down, and so we get that. And in the beginning, we had to come out really hard and strong against this virus. We didn't really know what exactly we were dealing with. We have learned a lot of information in the short time that we've been living with this virus. So I think where we are now and the decisions that we're making now are based on a lot of science that has expanded a lot since in March when we had our first cases, right? So we have to remember that first and foremost is that we are in a different place, and we know a lot more. That being said, we are still learning, and we have to be open as scientists. We have to be open to learning new things and to say, we need to change what we were doing. That's 100%. So for people who are having anxiety, I think you need to know first and foremost that it's normal to feel anxious in this situation. That there are services that are available if you have anxiety. Bridge the Gap is one place that you can go online to find some services if you feel you need to. You need to reach out and talk to people, talk to your parents, talk to your friends, to other adults that you trust. And if you really feel that you need help that, beyond that, whether it's, counseling help or you need to see a doctor, then you need to reach out and do that. There is there is no reason not to do that. You know, you need to take care of yourself. You need to make sure that you get the care you need. And self-care is very important as well. You know, if you're feeling overwhelmed, it's really important to acknowledge that and to say, I'm feeling overwhelmed, to talk about it. Sometimes other people have the same fears, and then reach out and try to find answers to those questions to help you feel better. But you need to know that there is a whole sector that's out there to be able to provide care if you need it. Not everybody needs that care, but certainly making sure that you have that support system is really important, and acknowledging your own feelings is really important as well, and to take care of yourself. Because you have to take care of yourself first. If you don't take care of yourself, then there's not that. It's very difficult to engage with others and to be a support for others if we can't make sure that we're getting what we need to feel safe and to feel healthy.
Absolutely, thank you.
Hi, my name is Megan Coles, and I am a third-year Bachelor of Nursing student at the Centre for Nursing Studies. I am also a Skills Canada alumni, as I have competed in workplace safety for many years. I am both a silver and national gold medalist in this competition category. Workplace safety is one of the competitions offered by Skills Canada Newfoundland and Labrador, as it is important for youth to know that they have the right to a safe workplace. What advice would you give to youth to feel comfortable to raise safety concerns at their part-time jobs?
Yeah, so I can see why this would be a difficult question for people, because you have, you feel like you're not in a position of power to be able to do something about that. But you do have a right to have a safe workplace. So first of all, if you feel like something is not safe, then I would certainly recommend that you look at the website. You look at, there are there's lots of information there about how to safely operate a workplace. If you feel that, after reviewing that, you feel like, okay, we're doing something that's not quite right, then certainly bring it up with your manager just to say, the information on the website is saying this. I noticed we're doing something differently. Is there a way that we can do this more safely? And try to find a constructive way through that to be safer. I mean, most workplaces, I think, want their employees to be safe. There's nobody out there right now, I don't think, who wants to be the reason that we have an outbreak. So I think most people are certainly wanting to be safe. And sometimes these things happen just because someone's not aware, or maybe someone is not, that was in place, but it's kind of fallen off the radar, or, whatever the case. So it's not necessarily a malicious reason why that's happening. Hopefully then that would be that first step, just bringing it up with your manager or your supervisor, that would take care of that issue. If not, though, and you do have concerns, there is a process that you can go through, occupational health and safety, that you can avail of. I can't explain that whole process right now, and I certainly wouldn't want to give anyone wrong information, but there is legislation and there are guidelines for how you can, if you have concerns, that you can. Those certainly would be, my recommendations if you did have some concerns about it.
Hi, my name is Julia Rose, and I'm a post-secondary student at the College of the North Atlantic doing the Construction Industrial Electrician program. And I'm also a Skills Canada Newfoundland and Labrador alumni and a Skills Canada National Silver Medalist in Electrical Installations. My question for Dr. Janice Fitzgerald is, SCNL delivers a program called Skilled Futures for Women, which encourages female youth to consider careers in underrepresented fields. What advice would you give to a young female student or anyone who may be interested in pursuing a career in medicine?
If you are really passionate about doing a career in medicine, by all means, pursue that passion. I think it's a lot of work. It's hard work for sure. my advice would be to make sure you study. But everybody thinks, oh, I have to do the sciences if I'm going into medicine. And in my experience, I've been over 25 years a doctor now. And in my experience, having non-science background sometimes is actually very helpful as a physician, depending on the type of physician you want to be. There are lots of different options. But in my former job as a family physician, some of the most important skills that I had, I didn't learn in a science classroom. I learned them, in more artistic background classes. So that's really important. There's a broad spectrum of skills that you need to have as a physician that you can't just get from science, and so you have to try to remember to do what you love and to do the things that you enjoy, and to do and follow your own path and how you think you need to. How you think you need to proceed with your life. I mean, medicine it's a difficult field to get into. It's becoming more and more difficult, I understand, as time goes on. I mean, it was hard when I was there. There were a lot of people applying for a small number of positions in the school. And I feel like it's even harder than that now. But it takes a lot of dedication, but it's certainly worth it in the end if you get into a field that you really love and that you are passionate about. And I guess for me, that's the most important thing, is to make sure that you're doing this and you find your passion for what you want to do. And your passion at 25 might be very different than your passion at 40. And that's okay. You can change. That's the good thing about medicine too. There is room for change. I started out my career as a family doctor, and now I went back and did a master's in public health, and now I'm doing this job. So, it's there are opportunities, lots of opportunities for change. So, but I think the most important thing is to make sure that you're doing what you love, and that you're because if you're doing what you love, I think it shows. I think it really comes through in your attitude, and it comes through in your in how you deal with people and how you approach your work, and so I think that's the most important thing, is to make sure that you really like what you're doing. You're not going to like it every day, and you're not going to love it every day. That's true, but for the most part, you need to make sure that you look forward to getting up and going to work every day. You need to be doing something that you enjoy and that gives you that sense of fulfillment.
That's a wonderful message. Underlying every program, everything that skills.
Yes, anything.
I mean, that's our message. Absolutely. That you find something that you love. It's no longer a job; it's a passion, and then you are going to be successful. You are going to do well in that role if you have the passion for it. So I really appreciate that answer.
My name is Caitlin Coles, and I'm a second-year pharmacy student at Memorial University. I'm also a Skills Canada Newfoundland and Labrador alumni. I competed in the job search category, and I'm a national silver medalist. The question I have for you today is, the cold and flu season is coming upon us. Do you think the precautions we are taking to help stop the spread of COVID-19 will also protect us from the flu? And how will flu vaccine clinics look different this year?
Those are two very good questions. So, I mean, the hope is that, yes, we will see a reduction because of, we certainly did last year when we closed everything down and people stopped going out. We saw a very abrupt end to our flu season. We hope that, with wearing masks, the increased hand hygiene, physical distancing, that will help with the flu season this year as well. But, nothing is going to be 100%, and we can pass flu around in our house, and you can be, like with anything, like with many viruses, you can be contagious before you're symptomatic, and so you could pass it on without even realizing it. So I think we will still certainly have a cold and flu season, and we certainly are seeing that right now. We have one virus circulating called enterovirus at the moment, and that's causing a lot of head cold type symptoms in people. So we're certainly seeing that. But we hope that it'll be a little bit less, but I guess only time will tell, because it depends on the strain of flu as well, and the effect of the vaccine on that. Flu vaccine clinics will look different this year, absolutely. We will have to take into account physical distancing. The mass clinics like we had before, where everybody just went and waited, obviously that's not going to be something we're going to be able to do this year. So we are working through those plans as we speak, to develop ways that we can, book appointments for clinics, that we can have a more controlled flow of people through the clinics. And every health authority is working on that right now. It's their priority at the moment. They're in the public health field of the health authorities. That's the priority, is flu right now.
And I guess you would certainly encourage everybody to avail of it.
Oh, yes. Sorry, I can't believe I didn't say that. Oh my gosh, yes, get out, get your flu shot. This year it'll be more important than ever to get your flu shot. It's certainly, we do know that the flu shot is our best defense against the flu. And from a healthcare capacity point of view, we know that every year during flu season, we see an increase in admissions, and that does affect our capacity. So we could be in a situation where we see a surge of flu and a surge of COVID, and we don't want to be there. So the best way for us not to be there is for everybody to get out and get a flu shot. And we really want to vaccinate 85% of our population this year. So, we really need people to get out there. So get your flu shot, tell your friends to get their flu shot, be an ambassador for the flu shot this year.
Hi, my name is Harrison Tilley. I'm a machinist from Clareville, Newfoundland. I'm also a Skills Canada alumni. Last year I competed in nationals and I placed silver. On behalf of post-secondary students, I'd like to ask you, do you think that we should be prepared for a second wave, and do you think that the lessons we've learned in the last 6 months will prevent another mass shutdown? Thank you.
That is our goal. I will say that we can manage this, and that's everybody's goal across the country, is that we can manage this without having to do what we did before. Part of the reason we did what we did before was because we didn't have a lot of information about this virus. We didn't know exactly how it would go in our communities, and so we went with everything that we had. We've learned a lot, so now I think we can refine our approach. We know that physical distancing is important. We know that large mass gatherings are important threats. So, we can get back to close to normal without having those larger gatherings. We can practice physical distancing when we're doing things. We have to be a little more careful, and as we move back indoors, because as it gets colder here, we tend to do that. Our activities shift to indoor activities. We have to be more cautious about that. We need to keep our interactions in close spaces as safe as possible. So you want to keep the number of contacts that you have outside of those close contacts as low as possible. But that's not to say that we need to go back to necessarily, where we were before. There may be situations where we have to close certain segments of the society. We may have to look at certain things depending on what we see. Like we saw BC just recently, they were seeing a lot of outbreaks in bars and nightclubs, and so they had to scale back that whole, how they were dealing with bars and nightclubs, and those are important things. Those are things that we have to look at, and I think we can be a little bit more refined now in how we deal with this. We've also looked at our healthcare capacity. We know that the health authorities have that ability now to scale up and scale back if they need to. We know how we can protect our vulnerable populations, such as those in long-term care facilities and personal care homes. We know about, we are watching our epidemiology very closely, and if we have certain red flags that we're looking for, and if we see any of those, we may have to close things down in a certain area for a short period of time. not necessarily the whole economy, but shut down. We may have to close schools in some areas, not necessarily in every area. And that's the other thing that we're looking at as we go forward, is that we're not looking to do this blanket provincial approach so much as a more refined regional type of approach, so that we can be a little bit more directed in the way that we respond to this virus. And we have to be prepared for that. We have to be prepared for more cases. It's unrealistic to expect that we're not going to see cases. We have to be prepared for cases in schools, and we are. We have the public health has been doing contact tracing and tracing infections in schools for many, many, many years, and this is part of what they do on a day-to-day basis. So a lot of those same principles still apply to COVID. So we know that we know how we have to approach this when and if we see cases in a school. But those are things that we have to be realistic, that these are things that we will likely have to deal with. But I think we're in a much different place in knowing how to deal with those things right now. We're still learning lots, and things may change. As we've said many times, if the information we get is different, we'll change the way that we do things. That's what we have to do with any disease, and especially something that's new like this. I think we are in a different place, and we do need to remember that it will take all of our cooperation. And so right now people are, we don't have a lot of cases, so people are feeling a little freer and that they can do things. But I think if we were to start seeing cases, just like back in March, people just naturally kind of cut back a little bit, like they started cutting back their own activities, even without us shutting down stores and shutting down businesses and things like that. So I think people understand too the importance of following those guidelines. So I think on the whole, we are as a society in a much different place with being able to deal with this virus.
And I think it's to give credit to the community for following guidelines and so forth. And I think if one big lesson that we have learned in this province is that, it's important for all of us to play our part. Public health is working tirelessly. Things are changing so quickly, but we've gotten good guidance to date. So we should continue to do that and respect the science and respect the guidelines that we are given to help keep each other safe. It's so important.
Yes, and it is important. And I will say, and I have said many, many times that Newfoundlanders and Labradorians have certainly have risen to the challenge of this virus, and I'm eternally grateful for that.
And I want to say thank you to our wonderful alumni for some great questions. I certainly learned a lot from their questions, so I appreciate their input on this session. Dr. Fitzgerald, I'm sure when you became Chief Medical Officer, a world pandemic wasn't exactly what you were expecting on your immediate horizon, and I have known that it turned your personal life upside down, your professional life upside down, yet you clearly have thrived in the role, and you have become the leader that we need. And
well, thank you.
And again, essential skills are so important. We talk to youth all the time about, essential skills in all workplaces. What would you say? What particular skill set do you think you had, or one particular, or a number of experiences that you've had in your history that kind of prepared you to jump into that role so quickly and be so successful in being the leader that you are?
Oh, I think, it's difficult to say. I guess being a family doctor for 20 years or over 20 years, you have to know how to communicate with people, right? So that's an essential skill that we have. Communication is so important. So being able to take your message and to take it from one, that's, we get scientific information, and to be able to take that message and make it understandable for people who don't have that science background, to make it make it practical for them, or to make it approachable for them, is really important. And I mean, I can't take all the credit for that. I have a wonderful team behind me who help me do that every day. And I have somebody who will write my speaking notes for me, and who, I tell what I want to say, and they help to craft that in a way that makes it very approachable, I guess, for people to be able to understand what I'm trying to say. But I've certainly had a lot of experience in trying to do that in my career. So that's certainly, I think, one of the big things that in this situation, that communication skill is really important for the job. I think the other thing is just being able to listen to different opinions, and to be able to entertain different opinions, and to look at all the sides of a situation to determine the best way forward. I mean, that's what this whole pandemic has been. There's been no right or wrong answers. There's been no playbook that we can go by. There's nothing to say, here's what we have to do. I mean, we've had lots of experience with other viruses, and I think we use some of that information to help us with COVID. But, by and large, we were learning and we were making decisions based on new information all the time. And so I think that's an essential skill for this job, is just being able to take all that information in. Being able to work as a member of a team is incredibly important in this job, because these questions there is no easy answer, and there's always going to be somebody who's unhappy with the result or with the answer. And there's always going to be unintended consequences of the decisions that you make, and that can be difficult. So I think there's that. So communication, very, very important. The ability to work as part of a team, and to listen to input, and to put your ego aside and say, I have to listen to what people are saying. It doesn't really matter what I want or think. I have to listen to what the evidence is showing me. And then there's always, I think it's really important we have to be able to take a step back and to evaluate, and to take a minute and say, okay, let's really think this through and what's going to happen. Those are all really important skills for this job. Of course, you've got to have that scientific approach to things. You've got to have that ability to evaluate. Those are learned skills that you have. Some of these other ones, the communication, some of that is a little more innate, I think, but I think they can be learned as well. I think that's important. And I think communication is important in any job. So if you have the opportunity to be able to take advantage of any kind of skills in learning how to communicate, I would encourage you to do that, because it's vitally important for a lot of jobs, and especially in public health.
Yes, I'm hearing a lot of the essential skills that we promote to youth: communication, teamwork, numeracy, thinking skills, continuous learning. And I'm thinking that you've also probably had to learn pretty quickly some significant digital skills to this virtual.
Oh, yeah, like Zoom.
Exactly. So that's a wonderful example of how essential skills are so important to any career. So I'd really like to thank you for giving us your time and expertise today. We know the demands on your time, and the fact that you are giving us this time demonstrates to young people how much you value their safety and the role that they can play as leaders in our community. So I'd also like to thank you on behalf of people of this province for your effective leadership. And I believe it's because of the policies, the work that you and your team, and as you mentioned, all that team that back you up, because of the policies that you've put in place, and to give credit to the community for following those guidelines. It's pretty great to be in one of the safest places on earth right now. So we have to give you a lot of credit for that. And We know there may be a lot of ebbs and flows. We know we're still learning. There's still going to be cases. We have to be prepared for that. But I think that you really and truly have instilled a confidence in the community that we can support each other and work together to get through this as safely as possible. So I want to thank you for that.
Thank you.
And as we clue up, I'd like to give you an opportunity to give one last message that you would like youth to take away from this session on how to keep their loved ones and their communities safe.
So I think the most important thing is to remember that we're all in this together and that we all have a role to play to keep everybody safe.
Thank you so much. We truly appreciate your time and expertise and guidance. And good luck with the rest of your day. I know you have another pandemic update today. So we wish you all the best. And we're here. We're on your team.
All right. Thanks so much.
Thank you.